Okay, everybody, Dr. Arafid from Vet Triage. We are continuing on with this issue of veterinary surgery from May 2022, and we are talking about the surgical ligation of patent ductus arteriosus in dogs, the incidence and risk factors for rupture. This study comes out of the University of Georgia and the University Texas A&M University. The objective is to determine the rates of rupture and mortality associated with surgical ligation of patent ductus arteriosus, also known as PDA, in dogs, and to identify risk factors for rupture. It's a retrospective study, 285 dogs. The results found the initial surgical approach was extrapericardial in 144, intrapericardial in 46, not reported in 94, or the Jackson-Henderson technique, which is 1. So right off the bat, you can tell one of the issues with retrospective studies is that the medical records are typically incomplete and they're also not standardized, as shown by there being 94 not reported, which is so crazy considering this is not just a surgery, this is a major surgery. And so to not have in your medical record what approach you used is very weird. Rupture of the PDA occurred in 7% of dogs, 20 out of 285. 13 were extrapericardial, 3 were intrapericardial, 4 not reported. Overall mortality 0.4%, so 1 out of 285, pretty excellent results. Additional major complications occurred in 1.4% of dogs, all in the non-rupture group. The overall rate of residual flow after ligation, 9.4%. Dogs with rupture were more likely to have residual flow than those without rupture. If ligation was performed after the rupture, rather than hemostasis only, no difference in residual flow rates was noted between dogs with rupture and those without. The conclusion was that the rate of surgical rupture with surgical ligation was low and no specific risk factors for rupture were identified. Clinical significance, successful treatment of PDA rupture is possible, evidenced by the low mortality rate in this population of dogs. Ligation of the PDA after rupture, either in the concurrent or a subsequent procedure, reduces the odds of residual flow. Introduction. The patent ductus arteriosus, or PDA, is one of the most common congenital heart conditions in dogs. Closure of the PDA is recommended when there is left to right shunting, either via surgical ligation or transarterial methods, including occluding devices such as the Amplatz canine ductal occluder. Surgical ligation is recommended over transarterial when the patient is too small or the shape of the PDA is not amenable to transarterial procedures. Closure of the PDA is recommended to prevent congestive heart failure and to improve long-term survival. Major complications associated with surgical ligation of PDAs are reported to occur in 6% to 15% of dogs and include rupture of the PDA with hemorrhage, lung trauma, residual flow, and cardiac arrest. Specific risk factors for rupture are controversial, with increasing age and weight being reported as significant risk factors in some studies but not others. Major complications, Major complications associated with transarterial procedures are reported to occur in 0% to 4% of dogs and include hemorrhage from the femoral artery, hemorrhage from perforation of the aorta, embolization of the occlusion device, and cardiac arrest. Reported mortality rates with surgical ligation go from 0% to 6%, and mortality rates with transarterial is 0% to 3%. Surgical dissection techniques used for PDA include extrapericardial or intrapericardial, or the Jackson-Henderson technique. The Jackson-Henderson technique has been reported to lead to increased rates of residual flow in comparison with an extrapericardial technique, although this was refuted in another study. The Jackson-Henderson technique is useful, particularly after rupture, as it eliminates the need to pass an instrument medial to the PDA, where the muscular wall of the PDA is weakest and rupture is most common. Materials and methods. These cases occur between 2008 to 2019. Successful transarterial procedure for unsuccessful transarterial procedure and subsequent surgical ligation were included. Residual flow was determined by evaluation of postoperative echocardiogram. Results: left to right shunting PDA, median age of the dogs 5.9 months, females 75.1%, males 25.6%, Chihuahuas made up 15.8%, followed by mixed breed at 15.4%, Maltese 10.5%, Pomeranian 8.4%, Yorkies 8.1%, and so forth. Median weight 2.73 kilograms, so very small dogs. 93% underwent surgical ligation without rupture of the PDA. 7% experienced rupture, no difference with age or weight. 11.6% had an unsuccessful transarterial procedure. All transarterial procedures were planned to use the Amplatz canine ductal occluder. The most common reason for lack of success with the transarterial procedure was that the femoral artery was too small. Occluder dislodgement occurred in 4 dogs, puncture of the aorta with a catheter, 1 dog. In the non-rupture group, they used extrapericardial in 49.4%, intrapericardial 16.2%, Jackson-Henderson 0.4%, or not reported in 34%. The suture type used most often was silk at 97.4%, followed by PDS 0.4%. Suture size most often size 2O at 61.9%, and then 0 at 23%. The rupture group, extrapericardial, was 65%, intrapericardial 15%, not reported 20%. All 20 dogs in the rupture group survived. Ligation was continued using the original technique, meaning intrapericardial, extrapericardial, or not reported, in 69.2%, or the procedure was converted to a Jackson-Henderson in 30.8%. They used silk in 100% of cases. Size 2O was 76.9%, followed by AUT at 23.1%. Dogs without rupture, no evidence of residual flow was appreciated in 92.6% of dogs at a median of 1 day postoperatively. 7.4% had residual flow initially, but at last follow-up, it resolved spontaneously. 8.6% had residual flow at the last follow-up at a median of 27 days. Dogs with ruptures were more likely to have residual flow than dogs without rupture. In dogs where rupture occurred but successful ligation was ultimately performed despite rupture, excluding hemostasis only cases, the risk of residual flow was not different from dogs that underwent surgical ligation without rupture. The overall rate of residual flow with ligation, regardless of rupture, was 9.4%. Major intraoperative complications other than hemorrhage occurred in 4 dogs in the non-rupture group, which is 1.4%, leading to a total major intraoperative complication rate of 8.4%. And if you guys care about the data, you can pause the video here. Just look at this table, which gives you all the information about these cases. All right. Overall mortality 0.4%, with no dogs in the non-rupture group dying prior to hospital discharge, so 0%. 1 dog, meaning 5%, in the rupture group died prior to discharge. Mean 9.3 surgical procedures per year. Transarterial procedures were not commonly offered until 2012 at this hospital, while the second hospital performed transarterial and 175 surgical procedures with a mean 14.6 surgical procedures per year. Transarterial procedures were performed regularly at this hospital for the entire study period. All right, discussion. And then this is, if you want more information, chart there. Let me show you the whole thing right there. Okay, discussion. Rupture of the PDA with surgical ligation, 7% of dogs. Previous reports of rupture with surgical ligation with an extrapericardial dissection technique range from 0% to 15.4%. Previous reports, the overall hemorrhage rate was 6.8%. Increasing age has been reported to be a risk factor for rupture. Older dogs may have larger hearts due to being larger in size and older age, and due to chamber enlargement due to PDA, sometimes complicating the dissection. Older dogs may have more remodeling, more scar tissue due to chronic changes from altered blood flow, which could lead to alteration of the vessel structure and more difficult dissection, increased risk of rupture. Increasing weight has also been associated with increased risk of intraoperative death and decreased long-term survival. Increased weight could be concerning for increased risk of rupture is that the PDA itself will likely be larger. This would lead to a greater surface area on the medial aspect of the PDA where rupture is most common due to the weakness of the vessel wall in that area. Additionally, with a larger PDA, larger instruments are required to span the width of the PDA when passing suture. These larger instruments lead to less precise dissection due to sheer size, which may increase the risk of rupture. It is also possible that certain large breed of dogs are predisposed to certain morphologies of PDAs that make them more susceptible to rupture. The overall mortality rate in this study was 0.4%. Digital pressure, hemostatic clamps, hemostatic agents, suture or vascular clips can all be used to control hemorrhage in the event of rupture. This low mortality rate is encouraging. Despite massive hemorrhage, hemorrhage control and survival is possible with proper preparation, including blood typing, having blood products, hemostatic materials, and knowledge of their application. Then there's the Jackson-Henderson technique, eliminates the need for passing forceps medial to the PDA. Similarly, the intrapericardial technique allows surgeons a slightly different position, slightly different location for dissection, possibly avoiding disruption of the previous rupture site when reoperating on a dog with PDA ligation after rupture. The risk of residual flow was higher with the occurrence of rupture, indicating that attempts at hemostasis without ligation of the PDA are likely to result in residual flow. When cases where only hemostasis was achieved without further attempts at ligating the PDA were excluded, the risk of residual flow was not different from dogs without rupture. Major intraoperative complications other than hemorrhage occurred in 1.4%. Inadvertent ligation of the main pulmonary artery or a branch of the main pulmonary artery were such complications. The vagus nerve with the recurrent laryngeal nerve branching off of it, cardiopulmonary arrest, associated with the Branham reflex, which is bradycardia that develops as the aorta experiences a sudden increase in pressure with ligation. Slow ligation of the PDA over 2 to 3 minutes has been proposed to reduce the risk of the Branham reflex occurring. Residual flow occurred in 9.4% of dogs with PDA ligation with or without rupture. This compares to reports showing a 21% to 49% residual flow rate with standard ligation and 36% with the Jackson-Henderson technique. Another study found 9.7% residual flow rate. One group reported as low as 6%. Moderate or severe residual flow may indicate insufficient tightening of the suture. Small suture may be more likely to tear through the vessel, while larger suture may be difficult to tighten fully. Surgeon experience was not associated with rupture, and overall, the risk of rupture with surgical ligation of PDA was 7%, overall mortality 0.4%, no risk factors for rupture identified. Surgeons should be cautious during PDA ligation and should be prepared to treat rupture and hemorrhage if it occurs. The odds of residual flow are higher if only hemostasis and not ligation is achieved following rupture. Successful treatment of PDA rupture is possible, evidenced by the low mortality. So overall, a really good study with good numbers. The problem is it's retrospective, so it's got inherent weaknesses to it. That's always a problem. But it's good to see that these surgeries, which are very, very scary surgeries, are being tackled more and more with institutions that are a bit more specialized to take care of them. So for pet owners, if your dog has a congenital heart defect like a PDA, you can find institutions. You'll probably have to drive or fly to get there, but it may be worth going that route since the numbers are getting better and better with better techniques. All right, guys, we'll see you again in the next video. Thanks again.